So why would an organization want to participate in HSPC? What would they get from it?
You know, speaking from Intermountain's point of view, what we're trying to get out of this is in fact higher quality, lower cost software to take care of patients. I mean, what we're ultimately trying to do is improve patient care. And in the current sort of siloed marketplace, you're dependent upon a single vendor for those applications that you can run in your environment. And what we're trying to do is create an environment where there's much greater choice and lower cost and higher quality choices for the software that we can run. And so if you're like Intermountain Healthcare, that's what's in it for you is the opportunity to better software. If I'm a software developer, it's an opportunity to create high quality software and have a marketplace where I can sell or share or open source my application and make it available to a lot of people and provide value to the marketplace. You know, if I'm an insurance company or someone who does cancer registries, it's an opportunity for me to be able to make connections that make data flow into my system at a much lower cost and a higher quality of the data for that environment.
So in order for this all to work, wouldn't the EMR vendors have to participate and enable these services on their platforms?
That's exactly right. One part of what we're doing is creating the standards, the definition of what you need to do to have these standard services. The actual work comes in the vendors implementing those services on their own platforms. And so they're going to have the hard job of taking data out of their current database and being able to format it and structure it in the correct way and use standard terminologies in order to serve that data up to applications. A really important part of what we're doing is working with the vendors to make sure that there's a business case and a reason for them to participate as well, because without them we wouldn't have a marketplace. We really have to have that kind of support from the vendors.
And how is the vendor support so far?
So the vendor support has been great. You know, we have a new business partner, Cerner, that has been participating. And in fact, this morning I spoke with Dave McCauley on a joint educational session about these new standards-based services. We've had good support from Epic. Early on, we had good support from Allscripts. Had good conversations with Athena Health and McKesson, actually. So we've had good conversations and we've had good support, and many of those vendors are actually, in fact, showing software, demonstration software at the HIMSS conference here this week. And so it's been good, and of course we're looking to expand and enhance the number of vendors that we've gotten involved in the consortium.